Hello, this is Beth Grigg, the Director of Windermere Residential Health Services, here to offer you a very brief presentation titled, Am I Having a Heart Attack? Some heart attacks are sudden and intense, where no one doubts what's happening, but most heart attacks start slowly, with mild pain or discomfort. Often people affected aren't sure what's wrong and wait too long before getting help. Call 911 if you experience any of the following heart attack warning signs. Chest pain or discomfort. Most heart attacks involve discomfort in the center of the chest that lasts more than a few minutes or that goes away and comes back. It can feel like uncomfortable pressure, squeezing, fullness, or pain. Shortness of breath with or without chest pain. Breaking out in a cold sweat, nausea, lightheadedness. As with men, women's most common heart attack symptom is pain, chest pain or discomfort, but women are somewhat more likely than men to experience some of the other symptoms, particularly shortness of breath, nausea or vomiting, and back or jaw pain. Pain or discomfort in other areas of the upper body. Symptoms can include pain or discomfort in one or both arms, the back, neck, jaw, or stomach. And this slide shows you some areas of the body where it is likely that you might experience pain during a heart attack. Even if you're not sure, call 911 to get checked out. Minutes matter. Fast action can save lives. Sudden cardiac arrest strikes immediately and without warning. Sudden cardiac arrest symptoms are sudden and drastic. A sudden collapse, no pulse, no breathing, loss of consciousness. Sometimes other signs and symptoms precede sudden cardiac arrest, including fatigue, fainting, blackouts, dizziness, chest pain, shortness of breath, palpitations, or vomiting. But sudden cardiac arrest often occurs with no warning. This is what they call the chain of survival. In sudden cardiac arrest, these are the steps optimally that will be done that will greatly enhance the chances of survival. Number 1, recognition and activation of the emergency response system. Yell for help. Tell someone to call 911 and get an AED if one's available. If you're alone with an adult who has these signs of cardiac arrest, go ahead and leave that person to call 911 and get the AED. The second step is immediate, high-quality CPR, which can be compression-only CPR. The third step is rapid defibrillation. What does that mean? That means using an AED, a defibrillator. We have defibrillators on every floor at Windermere close to the center elevator. All you need to do to work them is to turn the green button on, to push it on. The defibrillator will tell you what to do every step along the way and will show you what to do on the video screen. The fourth step is, of course, the 911 team, the paramedic team coming out to take over the situation. And after that is the advanced life support and post-arrest care that's done at the hospital. Just as a reminder, for compression-only CPR, there are only 2 steps to save a life. Number 1, call 911 right away. Get the help out. Number 2 is to push hard and fast in the center of the chest. And when the AED comes on the scene, then you can go ahead and push that green button and get started using the AED as well. When in doubt, call them out. There's no way to cover every possibility. That's why emergency medical service providers don't expect people to always be able to distinguish between emergencies and non-emergencies. If you think that you or someone else is experiencing a medical emergency, don't hesitate to call 911. Calling 911 is almost always the fastest way to get life-saving treatment. The paramedic team can begin treatment when they arrive, up to an hour sooner than if someone gets to the hospital by car. The paramedic team are also trained to revive someone whose heart has stopped. Patients with chest pain who arrive by ambulance usually receive faster treatment at the hospital too. It's best to call EMS for rapid transport to the emergency room by calling 911. Thanks to the American Heart Association for this important information. For more information, visit their website at heart.org or stop down to Residential Health Services at Windermere. We're always happy to provide you with more information. Thank you for attending this presentation.